Welcome everyone to our series, Hacking COVID-19, co-hosted by the Biohacking Village, MedISAO, and the Digital Medicine Society. Today, we're delighted to welcome Andrea Downing, co-founder of the Light Collective. Andrea, please introduce yourself and tell us a little bit about your organization.
Thank you so much, Jen. First of all, I want to thank Digital Medicine Society because it's been so wonderful collaborating with you for the last year, learning everything that I've learned at the Biohacking Village at DEF CON, and trying to figure out how to quickly mobilize through an effort to help my support group and other groups out there that are in need of help. So my name is Andrea Downing. I am an advocate within the BRCA community and a previvor or a survivor of a genetic predisposition to cancer. Within my own community, I have been working with an incredible group of women and men who face uncertainty due to hereditary cancer and have so been doing this for the last 10 years. And about 2 years ago, kind of fell down a rabbit hole, which got me to meet you, Jen, and the Digital Medicine Society at DEF CON. And that was becoming an accidental hacker, somebody who just started asking about the privacy implications of our support groups that reside on Facebook. And as I started learning about cybersecurity and privacy and all of the things that people that are experts in this field know, I started discovering things and becoming very concerned for the safety and privacy of my group. So we started a nonprofit called the Light Collective on a mission to help these peer support groups who primarily reside on Facebook. But across social networks, there are a ton of thriving support networks on Twitter. And there are also some other separate, really great platforms that I think are good actors in the space. Some examples of those include Inspire, the breastcancer.org network, and many others that we have been working with. But you know, this is kind of where I was kind of before COVID hit. What I want to do is just quickly share that the situation for our groups and my concerns about our lack of access to care and our high risk status as people who are going to be adversely affected by this pandemic are escalating quickly. What does that look like for me? Well, that looks like talking to two of my friends, one of it which who helped me find the original vulnerability in Facebook, who is now in the ICU with his son, and one of my dear friends and co-founders who is navigating uncertainty, and last I talked to her, she was in the hospital. I don't know what happens next. All I do know is that, you know, when we're facing triaging of resources and we're facing lack of access to care in the best situations, we have always fallen through the cracks of the healthcare system, and that is only about to escalate in a way that I think is going to be very difficult for a lot of us to see. So my goal today is to talk about that, to do what we've always done, and I'm just going to leave the rest of this presentation. I'll say really quickly, you know, we've been in need of partnerships. So first, partnerships with health systems who are trusted. I was originally thinking about this for the hereditary cancer community, but as I talked to the lupus community that is losing access to their medications, as I talked to rare disease communities and people within the cystic fibrosis community, we understand that we're not the only ones and we're not alone in these problems that we're facing. So we're seeking, again, partnerships. We need training not only on privacy best practices, but I think we're going to need training on things that we weren't originally expecting to need to help with. We need, as you mentioned, access to evidence-based knowledge, and we need it quickly in a way that is spoken in plain English and gives us the resources we need beyond, I think, the one-size-fits-all message that we're getting from the CDC, which is stay home. And I think a lot of our, at least in my experience with This morning, one of the messages I'm hearing from PCPs is stay home until you're turning blue. And unfortunately for high-risk people, that's probably too late. If you are turning blue and in acute respiratory distress syndrome, I don't think that is a good solution for people who are facing this and have comorbidities or pre-existing conditions. So I think we need definitely to sort through that. Something that I'm very thankful to Andy Korovos and Eric Paraxlis for kind of sticking with as we go through this is understanding that privacy and security is not a either or choice when it comes to digital tools, and anybody trying to tell you or tell us that we have to choose between privacy and sharing, good data on COVID, I think doesn't truly understand the privacy dynamics. We have seen that HIPAA has been now waived. So, and truly unprecedented movement of data on not only regulations, but things that I have never seen at this pace are currently happening. And we need to kind of figure out a way to respond to that and answer people's questions. One of the things that I've been thinking about all along is how we use a civic trust to do that. And it's kind of a legal mechanism. I'm not going to go into that right now. But on all of the above, I think more than ever, this effort needs funding, it needs support, and we need to start thinking about it as a disaster relief effort. And, we're kind of first responders. So with that, I'm going to, again, stop my screen. I don't know how to do that, and forgive me, I'm much better at Zoom. But let me ask what Jen, if you could guide me through the next part of this, I hope that was a helpful introduction.
Andrea, that was fantastic. And before we go any further, I want you very, very graciously thanked me and the DIME community, also our co-collaborators, Andy Korovos and Eric Praxlis, who Andrea, you and I often collaborate with. I want to, on behalf of all of us working in this field, thank you. The work that we do to try and bring the technology up to speed is all in the service of patients, and I look to you often in our work. Your courage and your tenacity certainly inspires me daily, so I'm delighted to be able to collaborate with you. And before I ask any questions, the manifesto of sort of 6 topics that you presented was compelling. 2 things, just so everyone listening can benefit. If anyone does want to partner, how can they get in touch? And for folks who want to follow along with your work, how can they do that?
So first, we are on Twitter. If you follow Be Like Light, that is our Twitter handle. It's open to DMs if you want to reach out and offer anything to help. The other way to get in touch with us is you can just email me, andrea@lightcollective.org. That is another way to get in touch. I'm currently, I think, as needs for help come in, I'm going to need somebody to help me triage that. So I will try my best to respond as quickly as possible. There is also on our website, lightcollective.org, a way to get in touch or just kind of fill out a form. And I do have somebody manning that. So those are the ways.
Fantastic. And if we dive into a couple of the topics that you mentioned and try and tease out a little bit more information, how do we think about it? Something that you said, Andrea, really struck me. There are always people and individuals who fall through the cracks in terms of healthcare delivery and access. You mentioned correctly that the risk of that is vastly increased during this time of crisis, and vulnerable populations are even more vulnerable. What's on your mind, and what are you guys working to do, and what are you seeking for specifically in partnerships to try and stop those most vulnerable patients falling through the cracks?
So I think the first thing I'm looking at is, how do we get, when we know that we don't have access to testing and going to a hospital could in fact expose a high-risk patient, the first thing on my mind is how do we create a centralized resource for getting people oxygen and scripts to oxygen? So let me break down how that kind of shook out with my friend. The first thing to know about pneumonia is it's a liar. And I am speaking from experience watching my dad go through this in early stages and then go to advanced or acute respiratory distress syndrome stage. What happens is your body tricks you into thinking you're okay, but you need to be able to track your oxygen levels in order to know, even if during the day you're feeling a little bit better, how to quantify your oxygen and be able to quickly, if you are declining, communicate that to medical professionals and then get you what you need. So what does that look like when you're calling a triage nurse at a primary care physician? The word on the street I'm hearing right now is that primary care physicians in triage are telling people, don't go to the hospital unless you're turning blue. And I think that's a problem because for high risk patients, if they are turning blue, they are probably getting to the point where they're in acute respiratory distress syndrome already. And by that point, we know that it may be too late for some people. And I don't mean to be alarmist. I don't mean to scare people. I'm trying to be as calm as I can. But for those people who are falling through the cracks, I do think that the best option for us, if we don't have access to care in the hospital, is going to be getting prescriptions for people at home, and perhaps some evidence around what decisions we need to make if we are seeing that something is quickly escalating and when we need to in fact go to the hospital and potentially risk exposure to COVID if that's not what we have. So think of the uncertainty here as twofold. The first is in any diagnostic situation, you want to be able to have clarity on what your health condition is. And if you have flu-like symptoms and trouble breathing, you're not going to have access to testing. For some people, that may mean the decision to go to the hospital will expose them to COVID, and the decision to stay home may worsen their condition. So the more that we can get people at home and get them the resources we need there and evidence to make decisions step by step at each stage, from the beginning of their experience when they're starting to know what their symptoms are, to if they start to have trouble breathing, what to say to the doctors, and then how to track themselves, but also if they need care, how to get them care at home if their healthcare provider is not answering. I think that's the right answer, but again, you guys are the experts and I want to kind of hand things over to the experts and say, what do you guys think?
And so this is why I so appreciate the approach you take, Andrea, in being such a powerful patient advocate, because what I heard there was a very clear call for evidence-based guidance for vulnerable patients out in the communities to know what to do in this crisis situation when there is so much misinformation out there, and perhaps a lack of information about specific decisions for specific populations. And frankly, you know, that's our goal with this. We want to get that message out there. We will commit to amplifying that. And it's a short session today, and I wonder if we can wrap by me asking one last question. You have an enormous support group. You have, I'm sure, in ways saved many lives of people who have gone through sort of genetic cancers. You have counseled them. You have a history of peer support. This is a challenging time. If you could say one thing to a vulnerable patient who might be listening to this during the COVID crisis and be nervous, what would you say to them? And what would you say perhaps to someone who has a patient like that in their lives right now?
It's a hard question. I would say that we've always navigated uncertainty. And when we think about how the world has come crashing down on us before, when we test positive for BRCA or when we go through a diagnosis. In some ways, that's our superpower. That's our strength because we've been through this before. This isn't our first rodeo, and we can use that knowledge of the healthcare system, self-tracking, and quickly getting to the place where we know the language to speak and the evidence from which to make decisions in order to help us and to help our communities. So what I would say is we know when the fear sets in that it becomes harder to do that. Time is on our side. Let's use time to our advantage to get these tools and resources to people who need them and to help them empower themselves. We've always done that through supporting each other and peers, through partnerships with experts that we trust. And the key is finding those people that we trust, but also reaching out when we need help. Don't be afraid to reach out when you need help, to say, I'm in trouble, or to talk to somebody if you're not able to get access from healthcare providers right now. Things are chaotic, and that's okay. We're going to support each other through this. The other thing I would say is just I'm sending out love to everybody. I know how hard this is. As somebody who lost her father to pneumonia 5 years ago this month, I also want to make sure that people's decisions are their own. And when I say that, it's something we've always known as patients we want for our families to be able to make decisions so that others don't have to for us. So use the time that you have as patients who are high risk to look at the evidence, especially for high risk people, and put together a plan for yourself. You know, don't wait until you're in crisis mode to have a plan, and to know who within your support system is going to be able to help you mobilize that plan if you need to.
Andrea, as always, the strength that you show is extraordinary. That message was terrific. Thank you for joining us today. We will share your contact information in the post along with this podcast or this recording, depending on how you're watching it. Andrea Downing at the Light Collective, thank you for everything you do. We will all be following Be Light Light, and you do inspire all of us. And I commit on behalf of our community to always be following your voice and the voice of other patients as we try and guide our work in this crisis. Thank you so much for joining us.
Thank you.